So what made me want to become a doctor? I would have to say that I've always been very much a people person. I've always loved to be around people. I've been very social. I enjoy people. I always look at the glass half full. And the idea of going into medicine was another avenue for me just to help people and be with people and interact with them. It's been a wonderful experience over 25 years, and it really has fulfilled all that I was looking for since I was younger and elected to go into medicine. To become an orthopedic surgeon, why? Because I just have always been into athletics, and I've always loved sports. And orthopedic surgery entails the care and treatment of athletes, and athletes come in all shapes and sizes. You have the little pee-wee football players, and then you have the weekend warriors, and even people that can be approaching their 60s and into their 60s. They could certainly be considered athletes in their own right. So it's a field where we deal with healthy people, where we can truly improve the quality of their life. In fact, that's been the mantra of my 25 years in private practice, that I don't save lives. I'm not a doctor who does that, but what I do is I improve the quality of life, and that's been very redeeming for me over the many years. And that's truly why I went into it, from the idea that I was dealing with healthy people, improving their quality of life, changing their life in a very positive way. I used to always say that I'll never be a very famous man, and I was really okay with that. But on the standpoint of each individual person at a time, I can be a hero to each person. In a small microcosm of one person at a time, I can make a difference in their life. And making a difference in one person's life at a time just means very much to me, and it's been the redeeming factor of why I've gone into orthopedics and why I love medicine and just love my practice and love my patients. The area of orthopedics I'm most passionate about is literally quite everything. I would say that ranging from being a surgeon to treating people conservatively and just people themselves. I'm very passionate about what I do. I feel that what I want to do is always offer the absolute best I can for each person, to the state of the art, the highest quality. And I think that at Suburban Orthopedics, we put together 4 of the most competent, highly trained doctors that you will find in any practice. So I'm really passionate about offering every person the best thing that they could get, and offering what I like to call the full court press. When a patient comes in to see me and they have a problem, what they want to know is that I'm going to leave no stone unturned to discover what the problem is and do everything in my power to fix it. I'm very passionate about that. It's very important to me, and that is what is my goal, is to do everything I can to improve the quality of every person's life in every single which way possible. How has orthopedics changed in my 25 years in private practice? It's changed in a lot of ways. It's changed a lot positively and some negatively. On the positive aspect, it's changed because of the use of an arthroscope. Many years ago, I did a sports fellowship, and I did it purely because I looked at the fact that the arthroscope was going to be the instrument of the future. And to a certain extent, it was somewhat prophetic that I was able to note that, and I became an expert very early on. But very interestingly, many years ago, we're talking 25 years ago, on the arthroscopic level, when you were doing, let's say, a shoulder procedure, that it was accepted that you could make a little incision and make sure that your work was fine when you were done, and then close up that little incision and just put your finger in there. At this day and age, that's not acceptable anymore, because everybody is that skillful. And most importantly, we also have that the equipment has advanced so much that literally I tell patients, if you want me to do something with an arthroscope, I can do anything with the arthroscope, except putting in a joint replacement, of course. And truly you can. I don't open shoulders at all anymore. Don't open up knees. This is not necessary in this day and age because the arthroscope and the equipment we have has been so incredibly advanced. Orthopedics also changed with the knee and hip replacements. It used to be said that the knee replacements would last 10 to 20 years. Well, the reason that it was said, because the plastic that you put between the two metal pieces that go on the thigh bone and the leg bone would wear out, and the wear particles from that plastic would then interdigitate between the bone and the cement that we used, and that would produce a loosening and therefore a failure of the prosthesis. And that would happen because the plastic wasn't strong enough. I now use a system where the plastic is probably 1,000 times the strength of the plastic that we used to use. And so therefore, I tell patients that are young that really need a knee replacement that as a disclaimer, your knee replacement is not going to last you your lifetime, that you're going to need a revision. But on the other side, I tell them I really feel because of the metals and plastics have advanced so much that I think it can last and will last your lifetime. So I think that's been a tremendous advantage in orthopedic surgery. The positives certainly far outweigh the negatives. Taking care of people, helping their lives. I mean, the best time of my day is when a patient will say to me, "Doc, thank you so much, you changed my life." That's something that is just, it's the best, and it's the best feeling that one can have. So it really means the world to me that I could do that for patients. So I've been asked the question, what sets me apart from other orthopedic surgeons? And I think what it does is several things. First of all, I'd like to take Suburban Orthopedics as a whole, as a group, that we offer the highest quality. Now, every group will tell you that, but we, I think, live up to it. The old story, we do talk the talk, but we do walk the walk with it. Just look at the credentialing of our doctors, look at the intelligence of them, look at their surgical skills. And I think that if you look at our group, the surgical skills or the ability that we have to do things is far better than I think that you will find anywhere else out there. I've always said that I might not be the smartest guy in the world. I think I'm certainly smart enough. But the one thing that I've always had in medicine that I really think sets me alone apart is what I like to say, I just get it. When I see a patient with a problem, and when they come in with different complaints, I just know what's going on. Many times I tell patients that when I'm talking about the problem, I tell them, and you're feeling this and you're feeling that, and they go, yes, yes. I said, I don't need to ask you that because I understand what you're telling me. And it's one of those comments that I'll just say, I just kind of get what happens. And not everybody does. Like for instance in surgery, to me things that are just so intuitive about what to do in surgery, to many surgeons are not. People don't understand that not every surgeon, because they operate, are the same. There's many people who don't understand the concepts of surgery and how to approach it and what the surgeon has to go through. Not everything is a step-by-step textbook approach to surgery. Many times, what makes, in my opinion, a great surgeon is when things aren't going exactly as you thought. What do you do for your plan B or plan C to make sure that it goes well and you get an excellent result when you're finished? And it might not be exactly how you intended to start with, but that's okay because you got the result that you wanted. As one of my old mentors and one of my professors in Cincinnati when I did my fellowship many years ago told me, I've lived by this adage for 25 years, which is that if you spend an extra 15 minutes in the operating room to get 15 years of success that you never would have gotten if you didn't spend that time there, it was worth every second you spent in the operating room. And I've lived by that. I also live by the adage of that I treat everybody as if they're a family member. What would I do if this was my brother, my sister, my mother, my son, and my cousin? What would I do to them? And that's what I do to every patient that walks in. And so I think generically, Suburban Orthopedics, the real thing we do is we care about people. We care about what happens to them. And I think that starts from the bottom, from when you to the top, or from when you walk in the door to the end when you leave. That's what we do. And we do that, I think, very well. And so we try our hardest on it. And that's why we love our patients and why our patients have been so wonderful to us over the years.